Well, hello, folks. Welcome back to another Massachusetts Central Radio Show. If I can get the words out, thank you very much. Hello, everybody. Welcome back to episode 124. I think it is. I did a, I did a, I did a short yesterday because I didn't have enough time. Thought I was going to record one earlier today, but I had a bunch of stuff to get in the way, and I had to do a bunch of stuff around the house. So I'm going to do one. Um, I might do one earlier tomorrow after I get back home from. Um, well, actually, I have to wake up at 8 o'clock tomorrow, so I might do one. So I might do a 15-minute one tomorrow, and then, well, yeah, I have to get up at 8 o'clock ish. So, what I might do is I might record one when I get up at 8 o'clock, 8:30, because I have to be out of the house at 9 because I have an appointment because we have I have an eye doctor appointment at 10:30, but my dad has one before me at 10. Um, so I'm gonna probably record one. Yeah, I'm probably gonna record one early in the day. It may be in the afternoon sometime, maybe 2, 3 o'clock ish. And I will say this, guys. I'm looking forward to um, doing one. This is a little bit earlier than 12 o'clock. So I mean, than 12 o'clock, 11 o'clock. Um, so I just want to tell you guys that I'm doing good. Things are going well, and I feel fantastic. It's definitely going to be a. It's definitely going to be some fun time. So tomorrow marks the last day of November. We're heading to December on Tuesday. So I will definitely be covering the last 2 days of. I will definitely be covering the last 2 days of November. And then the next time you guys will see me is Wednesday the 2nd, um, which will be my first radio show episode. I think it'll be 125 will be, well, 126 will be. Um, and then I will have one on Friday, Saturday, Sunday. So by the time I get to Monday, I should have over 130. So, and then the next 2 weeks will be five each, mostly, um, and such. So, and I'll have five more over, so I'll have 5, 10, 15, 20. So I'll probably have somewhere in the region of 100. And um, so if everything goes according to plan, I'll probably have somewhere in the region of 145 plus. I'll probably have somewhere in the region of 145 plus, which will be great to end the year. And if I do extras for Christmas, because Christmas this year is going to be a little different. We usually hold Christmas every year, um, but this year it's canceled because just because of COVID and the amount of people. So we might hold something. We might open presents, and we may hold dinner with maybe my um, dinner with Chuck and Chuck, Renee, Miles, and Caitlin. I don't know, Miles's girlfriend, because um, just because of the regulations, and New Year's might also be muted this year. We're definitely going to be home. We're all definitely going to be home a lot this year because it's just, and we're going to be with family, which is what the holidays is about technically. So and I'm just content with having that. I'm obviously gonna keep looking out and talking to friends as the weeks go on. It just doesn't feel like a regular. Um, it's not gonna feel like a regular December. But to be honest, at the end of the day, with all that's happened this year, I think I'm thankful and happy that all my friends are healthy. My friends are safe, and they're all doing well. So I can't really complain much about that. I will definitely, as the vaccine, when the vaccine does get approved and we all can get shots, um, and this virus, and we can stop wearing masks again, um, whenever that will be, because we have no idea when it's going to get approved. We'll be able to drop our mask and we'll be able to get together again. And when that happens, we'll definitely um, we'll definitely be ready for it. So this will be our second winter with the virus um, coming up. So um, whenever this vaccine gets approved, it's going to take a long time because um, they are already shipping the vaccine over here from Brussels and Europe and over here to the United States. I hear they're packing the planes with 50,000 pounds of dry ice to keep these doses cold. So when they are effective, when they are actually ready, um, we all can get them, and we can, um, and we can start to distribute them to people that need them, and we can get this done and over with. But I'm expecting them to approve it by. Um, I'm expecting them to give the go ahead. They're probably going to give a go ahead for the vaccine in um, in December, but or January. But the chances of us all getting the vaccine soon is going to be first come first serve. So we're definitely going to be waiting on a list, and we shouldn't wait. So as soon as I get the opportunity, I'm definitely going to make sure really get the shot so I don't get it, and um, we'll be able. And as soon as things got all straightened out, um, whenever it gets straightened out, um, we'll obviously be able to drop our masks and be able to work with each other and be able to see each other smile with our faces again, see our faces again. That'll definitely be great, so we don't have to live like it. And it's a lot of people are starting to. It's really starting to wear on people. I guess wear on people that the masks are starting to get bothersome. I can definitely sympathize with that since I do have to wear one. Um, I definitely have to wear one every day. So, and my mother knows that. My father knows that. Um, and I just want everybody just be patient, and we'll just let this thing come out, and they'll distribute it. But as I said, they're packing these planes and these boxes, these carriers with 15,000 pounds of dry ice. So they want to keep these doses cold so that when they get to the places, they have a chance to they have a chance to we'll have a chance to do what we need to do, and obviously get everybody else. I think the way the vaccine should go first is the people who are actually suffering from it in the emergency rooms. I definitely think frontline workers, the nurses, the doctors, the surgeons who are at risk about this should get it first. The elderly should be in line in first. The first couple of batches of doses should go to frontline workers, the elderly, the most at risk, anybody with immune problems. I'm pretty sure that's gonna. I'm pretty sure that's. I know Megan's mom has an immune system that isn't so great because she had surgery not long ago. She had chemo, so she's definitely one of those people that should get it first. The elderly, anybody in the vulnerable age range of 65 and older should definitely get it first, and then anybody who works in play, and then after that, anybody who works in places where human contact is a lot. So frontline workers, not only that, but for people who work in food should be getting it. That's me. Um, After that, but I think it should be those people that are sick first, the ones that they can save at the hospital, the people that are dying on these respirators. Anybody who's close to that should be anybody they know who's going to be know they can save. They should definitely be giving those people the first. So the most vulnerable and the sick first, um, and then work your way to the people um, who are vulnerable in getting it via contact, people who showed symptoms in the past. That's definitely me. Um, and But as I said, I tested negative, um, so it'll definitely be an interesting way how they do it. But I think that's how they should do it first, and they should definitely have approve it when they have enough to go around. There'll definitely be more than one batch because they're going to have to keep producing this till they rid the world of this. And um, I'm pretty sure the CDC, the World Health Organization, or WHO as they call it, the WHO as they call it, the center of the control, the Center of Disease Control, CDC. I'm pretty sure Dr. Fauci will come on. Will come on, seeing as he's the biggest name and the biggest guy to go to. I mean, Dr. Fauci. I mean, a lot of people are probably talking bad about him, but Fauci has dealt with more epidemics and more viruses than my generation will care to know. He dealt with the AIDS. He dealt with the AIDS pandemic. He dealt with all the bird flu, H1N1. He dealt with a bunch of the. He's actually seen a bunch of these epidemics happen. Um, he definitely knows more than most of us do. And he's one of those guys that are the he's one of the guys that are one of the leading experts, leading brains on this whole thing. Him and his team in the him and his team of guys, experts or boffins, um, is the not buffoons, boffins. Like boffin is a British term for experts, people who scientists, guys who um, work on this stuff. Um, it's it's going to be interesting to see how this all plays out. So I just want everybody to stay calm. I'm pretty sure the government has come up with a method to distribute, so there'll be no rioting or anything because it's the last thing we need. Because with all the crap that's been happening, um, and we should be figuring out a way to get the. We should be coming up with a program that will be able to get these vaccines to people who are not as fortunate enough to pay for these up. And it'll be a little bit more money for the government to spend, but the people who, but we need to get this vaccine to everybody, and I'm pretty sure we will figure out a way to distribute it and make sure everybody gets it in an orderly fashion. Um, I'm just praying to God praying to God and the powers that be up in the world, up in the sky, up in heaven, um, upstairs, will guide these people um, to make sure that we all stay healthy and we rid this pandemic because it's almost going on a year now. So next December will be its first anniversary. Will be the first complete year we've had this virus amongst us. So, and it hasn't been easy for anybody to connect with anybody or anything. So, the faster they can get this virus killing vaccine produced, and the faster they can get it approved, is the faster we'll return to a semi-normal life. We're definitely going to have to still live very caution wise with it. And we're definitely going to have to evolve, and we're definitely going to have to evolve our medical science with it too, because like any virus, it can change in a heartbeat. So I'm just praying that they track it and they keep it going, because keep all this progress going, because um, we've done our part for the last year or so to combat this thing. We just need to combat it, and we just need to be patient with it, because we don't want it to be over too soon. We don't want them to launch the vaccine and not for it to be effective. We have to do it when the trials are positive enough and when things are stable enough for this to eventually do that. And that's the faster we can all return to our normal lives. We're obviously going to remember it, because we've lost hundreds and thousands of people here in the U.S. We've lost, I believe, um, I don't want to load you guys with stats, but yeah. So March 2nd, we had 16 cases, and we've gone all the way up to 151 cases. Um, so in the so in the so in the U.S. we have 13.4 million cases. It's up almost 150,000. Total cases worldwide, though, it's 6.26 million. 40 million have recovered. Um, so that means 22.6 million are still in conflict, and are still in doubt. And um, there's 1.6 million deaths. So this is definitely, so we almost have a million. Over 1.5 million deaths so far. So in the world. So we're definitely going to have to honor those people, and um, definitely pray for their souls, to put them in to peacefully bring them to the afterlife, and into heaven, because they died almost a hellish death. So an unnatural death, shall I say, because of this virus. So my thoughts and prayers go to every soul up in heaven right now. The 1.46 million people that have lost their lives to this, I pour my soul and my heart out to all those people up there, and for those people who have lost their loved ones to this menace, this virus. I just want to say we definitely have to prioritize who we're going to give this to, and when it does get approved, because I want my shot, but I want to make sure the people that really need it get it first. For somebody on the front lines, yeah, it's important for somebody who's an essential worker and who's fighting for my country. I do want to actually have it to stay in the fight, but the people who need this are the people who are getting, the people who got infected, the people who are currently in hospital fighting this. Those are the people that need to get this first, because we need to see what it will do in certain conditions, and then when that happens, if those people get the symptoms, all that means it'll work on us too, because But yeah, guys, stay safe, social distance, wear that hand, rub that hand sanitizer, wash your hands, be socially aware of your surroundings. We should get through this. Everybody, I pray and God pray for this country, pray for the recovery from this virus. Let's all stay safe. Let's stay strong. Let's don't give up the chase. Let's keep holding on. Good day, guys. And pray for my friends. Let them stay strong. Let them stay healthy. Let them overcome their obstacles. I'll see you guys in the next one. Peace.